Hi, everyone. We're going to give everybody a few minutes to sign on, okay, and then we'll get started. Okay, guys, we're going to get started. So if you are here, please turn on your videos so I can give you guys credit for attendance, please. Can you guys all hear me? Yes? Okay, someone shake their head. Thank you. Okay, it's good to see you guys virtually. I know I see some of you in other classes and stuff, but we are going to be hopping into our skills assessment portion of this class. So today, do you guys have any questions thus far on how we are going to proceed on things? Or does anyone have any issues or any concerns? Okay. All right. Well, I've got 5 of you out of 10 of you. So that's a great way to start a Monday morning. Okay. We are going to start our skills assessments in class on Wednesday. Okay. So before we do any actual skills assessments, I will obviously go over them all with you. Do you guys on your Blackboard have an actual tab that says skills assessment? Can one of you check for me? I know mine does, but I'm not sure if yours does. Does anybody look?
Yeah, we got one.
You got one?
Yeah.
Okay. All right. So those are going to be, that little tab is going to be your saving grace. So what's in there is going to, it's going to denote every skills assessment that we are going to do for classes. Obviously, I'll let you know what we were doing beforehand. So obviously, I know we've lectured, you guys have done questions, you have taken your exams. I know exams were online, but you guys all did a pretty good, actually a very good job of that. Most of this stuff is pretty straightforward. Okay. Most importantly, when we get into actual stuff, it's important that we know how to do the actual actions of it and being able to recognize an emergency and what our next steps are. So make sure before we have skills assessments, you guys are actually going into those skills assessment, the Blackboard page, okay, and bringing stuff up, because it'll give you the entire sheet that I'm going to use to actually evaluate you guys, okay? So once we have an actual skills assessment, I'll call you up individually, or I'm going to call you up in pairs, however I decide we're going to do it. There's going to be some hands-on stuff. There's going to be some scenarios, things of that nature. I know with the era of COVID and things like that, if you guys are sometimes not, I think most of you will be fine, but if you are unsure or uncomfortable with certain things, please let me know. I can figure things out and have you do the skills assessment in a different way. I'm going to try to make sure that I keep you guys as safe as possible. As long as you know how to do it, verbalize it to me and actually show it, even if it's not necessarily, say, putting a bandage on another person. I will give you guys the credit for it. Okay, I know everything now is a little goofy. I know with the way things are going, obviously we are still hybrid and we can still go to class, but you never know. Who knows if we'll have to like hop online or something like that. Okay, any questions thus far on any of that stuff? No. Okay. Can you guys hold on one second? Let me get another screen going here. All right, you guys can see this screen that just says Zoom, right? Yeah, someone, yes, no, okay. All right, I know we haven't been face-to-face in a while, but you guys are able to talk. Okay, so what we are going to do, okay, so we're gonna have 4 skills assessments that we are going to do on Wednesday, okay? So we're gonna do how to remove gloves. We're going to be placing an unresponsive person in a recovery position. That's not it. Hang on a second. Finding out what is wrong with an alert and responsive person. And then lastly, performing the physical exam. So I'm going to go over each and every one of these with you guys right now. So we can actually understand what we are doing. So sorry, I have a million tabs open here. So let me see this. Okay. So the first one, how to remove gloves. Do you guys want me just to talk you through this, or do you want me to take you to the slides with the actual glove removal? What would be easier?
Slides.
Slides. Okay. All right. Hang on one second. Let me find it. Okay. All right. I think it's in this slide. Hang on. Nope, just kidding. Hold on, other ones. There's a million slides. Okay, so you guys can see, obviously, personal protective equipment, right? Okay, so when we are removing our gloves, obviously, okay, in everything that we do, if we have an actual first aid kit, whatever it might be, okay, we should always be wearing gloves. Obviously, in the real world, if you guys are faced with an actual emergency, that is not always possible. So if that is not possible, you have to take that into consideration when you're treating someone, and then you always have to make sure that you are cleaning your hands afterward. Yes, hand sanitizer helps. However, you should be washing your hands with soap and water for 15 to 20 seconds. I say rule of thumb, at least 20 seconds. So if I ask you guys these things, make sure you know what steps are taken for those. Okay, so when we are going to removing the gloves, and we will practice this before we actually do it, okay? it looks a little bit more complicated than it is. Okay, so if you guys think about it, and we have gloves on, okay, we want to make sure we remove the gloves without getting any sort of substance that might be on our gloves in the safest manner. Okay, so if we're looking at this slide right here, okay, whether you start pinching the left hand or the right hand, it is your personal preference. Okay, obviously, maybe if you're left-handed, you'll go to pinch the right hand to remove the glove. Maybe it's a little bit easier for you. That part doesn't matter. Okay, so we have these gloves here. The first step would be to pinch one glove with on the outside near the wrist. So if you can see this, they're pinching the glove on the outside. Okay, they're not touching anything on the actual glove that would be contaminated. So this area is going to be less contaminated. It could still be contaminated, but that's all right. So you're going to be pinching on the outside, and then you're gently going to pull off the glove, keeping it inside out. So if you guys can see it, you're basically taking that glove and pulling it inside out. Okay. You can see that this person is grabbing the glove, and it's now going to stay in that hand that first pinched it. So if we go to the next slide, see, we see it right here. It is now in that hand that we have pinched it. Okay. After we have that and we've removed the glove, this hand is obviously clean. Okay. Now they're going to take 2 fingers and slide it underneath on the wrist side. Okay. On the inside right here, slide it under, not contaminating your other hand. Okay. And then they're going to take it and also slide it out. Okay. And make sure that it goes inside out. Okay. Once we have done this, you are still holding the glove here. Okay. And then you are going to dispose of it. To technically dispose of it, we're either going to dispose of it in a biohazard container. Okay. Or we are going to dispose of it in a sealed plastic bag and then put it into a container. Okay. So make sure you know those steps. So if I ask you how you actually dispose of your gloves after you take them off. Okay. I know it looks a little bit more daunting than it really is. Like I said, we will practice this beforehand, okay? And I will give you guys cues. As long as we can do this, and we'll probably do this together as a class, I need to make sure that I visually see you all doing it, okay? This might take a couple tries. I will obviously pass you all on removing the gloves. Are there any questions on how to actually remove the glove? If I find a video, I will send it to you as well. Okay, any questions on any of that?
No.
Okay. All right, it's really not that difficult. Sometimes it just takes a little bit of practice, okay? So if you guys go to, hang on a second, let me find the screen. Hold on a sec, sorry guys. Okay, so this is the actual, not syllabus, the chart that I'm going to be following for you guys to be removing the gloves. So obviously the first step, and you're going to see this on almost every assessment that we do, is going to be take or verbalize standard precautions. Okay. Obviously it is implied that you guys are always going to be taking standard precautions. Okay. However, if I ask you a question, just answer it as well as you guys can. Okay. So then if we just go down the line, obviously you'll see that it's begin by removing one glove, pinching on the outside. So that's 1 point, gently pulling the glove off, keeping it inside out. That is important, okay? Then we're gonna remove the second glove by sliding 2 fingers in there with your bare hand, and then also turning that inside out. And then obviously at the bottom, how to dispose of that glove. So this is why I'm saying, look over these things. You don't need to print these out or anything. I will have these for you on Wednesday. Okay. So any questions on how to remove a glove? Okay. I think we should be pretty good on that, but again, we will go over this a little bit before we do it. Okay. So obviously next skills assessment is going to be finding what is wrong with an alert and responsive person. Okay. Before we go into that, can somebody tell me if you are going somewhere and you see an individual and they are unresponsive, whether they are breathing or not, what is the first thing after you have sized up the scene and know it's safe to approach the person? What is the first thing that you would actually do if you find an unresponsive person?
Call 911.
Call 911. Okay. When in doubt, guys, call 911, okay? But just remember, when we are going somewhere, we are coming up to whether it's a scene or you just see someone pass out, say it's in the hallway of a building, something along those lines, you have to make sure that it is, first of all, safe for you to approach, okay? Do you guys remember any of the things that we would do to actually size up a scene? What we do once we get to the scene to assess it? Can anyone give me anything for that?
Was it look for a witness?
So one of it is obviously if you guys are looking, you can look to see if there is another witness. Yes, so if there is another witness and you are the one that decides to approach the individual, either yourself can call 911 or you can tell that witness to call 911. Okay. Other things to remember, obviously, you need to look around to assess what has happened. Okay, like I said, if it's just in the hallway of your building, okay, maybe someone has passed out. Say you're approaching a scenario and it's a car accident on a highway. You have to see if you can approach safely. Okay, are there cars still screaming by? Is there only one car that has been hit? Are there other cars that have been hit? Can you see how many people are injured? Things of that nature. So you always have to make sure you size up that scene first. Okay, make sure that it's safe for you to approach if you decide to help. If it is not safe for you to approach, then you can approach and obviously call 911. So these are the things that we are going to do regardless of what happens, okay? When we say take or verbalize standard precautions, that's number one. The other thing is you guys always have to act as though the other person, okay, might be infected with a disease, something along those lines. It's just to protect yourself. So you want to be taking precautions to protect yourself. If there is blood everywhere, you do not have a sterile dressing to grab, you don't have a clean t-shirt, you don't have gloves, you have to make that call whether it's safe for you to approach. Okay, does that make sense to everybody? Okay, so if we were finding out what's wrong with an alert person, okay, so obviously the first step, we're going to take or verbalize standard precautions. Okay, you're going to perform the primary check. Do you guys remember what the primary check is?
Yes.
Can you guys give me some steps on that? I'll bring it up too on the slides. Let me see. Okay, hold on. Let me get this. Sorry, I always have an issue trying to change these slides. Okay, all right, so your primary check, okay? So it's basically going to be your first impression. You've sized up the scene, you've decided whether you're able to approach, things of that nature. So if we go back and we actually look for size up the scene, okay, so this is all in chapter 4. So make sure you guys are also referencing your slides. Okay, so let's take a step back for a second. So you're looking for hazards, you're gonna, aware of the potential violence of the situation, what's happening, car accident, whatever it may be observant for weapons, okay? We don't know if it's a scenario with gun violence, something along those lines. There's a million and one scenarios that we can think of. If the scene appears hazardous, you don't go in, okay? First and foremost, you have to be safe. Reduce exposure, that's what I was talking about. You guys have to make that choice if you are able to protect yourself from bodily fluids, blood, things of that nature. And then you try to determine whether the problem is injury or illness, whether the person had a heart attack, they had a diabetic episode, or they got injured. They were in a car accident, they were electrocuted, something of that nature. Okay, so now we're gonna go to our primary check. Okay, so this is your first impression. Obviously, is it illness or injury? Okay, is the person responsive or unresponsive? Remember, we talked about if you know that they're unresponsive, that's an immediate call to 911. Okay, are they breathing adequately, talking? Do you guys remember what other things we could look for at a person before actually approaching them to know if they are having breathing difficulties? There's a few things that we could look for. You guys remember any of that?
You're saying wow.
So if you approach me, okay, what can you see without actually even talking to me, or what could I be doing that would lead you to believe that I'm having difficulty breathing?
Maybe the way you're trying to be like gaspy.
Yeah. Okay. So remember, like extreme gasping, that little cough, like you can't get it out, or someone's coughing a lot. Those are all signs of someone having difficulty breathing, whether it be for something like a heart attack, inhaling toxins, something like that, whether they're choking, anything along those lines. Can you guys think about what on like my appearance, maybe in my face, my fingernails, anything along those lines would denote that maybe I'm having difficulty breathing as well?
Discolored.
Discoloration. Okay. So if my face is blue, if you can see my fingernails may be blue, that could be poor circulation. That could be a cause or could be a symptom that I am not breathing adequately. Okay. So all things of that nature. Obviously, then we're going to look to see if the person is bleeding. And this will obviously go into effect when you guys are doing the actual physical exam. But is there visible blood? Okay, do you see blood on the ground? Do you see blood on their clothes? Anytime we see bleeding, we have to make sure that we figure out where this is from, whether it's just a cut or it's an injury where you have a lot of bleeding and then you need to obviously control that bleeding. We'll get to that as well. Okay. Then you're looking at things like chance of exposure to blood and body fluids. Okay. Are you willing to be exposed to them? Are you able to have protective equipment like gloves, different t-shirts, anything along those lines to protect yourself? Okay. And then obviously, is there a danger to you, the injured or ill person, or the bystander? If there is danger to you, you guys are probably not going to approach. You're not going to put yourself in that situation. If there is a danger to the injured or ill person by leaving them there, what will you do with that person? You guys remember?
Wouldn't you move them?
Like, if there's no sign of spinal injury, don't you move them?
Yes. Okay. So if the person is going to be in greater danger because you are leaving them in that scenario or that situation in that scene, you need to move them. Rule of thumb is you do not want to move anybody. Okay. The reason you don't want to move anyone is because if you suspect a head injury, you're going to act as if that person has a spinal injury. Okay. If they obviously have a bone break in their leg and you were to move them and it is going to cause greater injury, you don't want to move the person. But the only time when all this doesn't matter that you would move the person is if they're in greater danger by staying there. Okay. So, I mean, this is like a crazy scenario that just came up in my head. If you found someone lying on railroad tracks, okay, I know, crazy scenario, and you could visibly tell that they have injured their leg, it might be an issue to move them, but you know a train might approach, you're moving that person. You are taking their life into consideration before allowing them to stay there, okay? We will get into all that stuff later in our skills assessment on how to help someone with a spinal injury and all along those lines. Okay, so all things to remember with your primary check. Okay, any questions on more of the primary check? Okay, obviously then we would go into asking or checking for responsiveness. Okay, so let me go back to that sheet really quickly. Okay, so we've done that with the primary check, and now you're going to check for responsiveness in that person. Okay, obviously you will know if you go up and tap someone and they don't respond, you know that they're unresponsive. If they are sitting there, okay, and their eyes are open, you want to make sure that you make eye contact with the person, introduce yourself, and ask if you can help. Remember all the way back in chapter 1, okay, you're supposed to ask if you can help. If you go to a person and something has happened and they are completely comprehending everything and they say, no, you may not help, you cannot help, okay? It is implied that you are allowed to help if this person is obviously in shock, not breathing, anything along those lines, bleeding significantly, things of that nature. Remember, you are protected by that Good Samaritan law. Okay, so first thing you want to do is make sure you make eye contact, introduce yourself, and ask if you could help. Okay, you're going to ask what happened to the person, okay, and ask where it hurts. Okay, a lot of the times they'll be able, if it's not a super serious situation, they'll be able to let you know exactly what happened. That way you know how to proceed in that situation. Okay, you're going to scan the body for any severe bleeding. Okay, if found, you're going to control it. Okay, we have a whole skills assessment on how to control the bleeding, so you don't have to worry about that necessarily this second. Okay, if the person is responsive, but they are severely injured, you are supposed to call 911 or ask a bystander. What are some things that could denote if a person is severely injured? Can anybody give me an example?
Um, I guess the amount of blood that yeah, the amount of
Yep.
blood.
Severe bleeding is absolutely a call to 911. Okay. Also, discoloration in your face. So, like if you're blue, okay, and we talked about discoloration of our fingernails, things of that nature, something that denotes that you are having difficulty breathing. So, anything along those lines means that you should call 911. Now, if you find a person and they have injured their leg, okay, and you can't, so say they broke their bone, and you can't move them yourself to the hospital without injuring them, then yes, you would call 911 in that situation again. However, if you find someone that twisted an ankle, things along those lines, that doesn't always mean that you need to call 911. If you are able to transport the victim on your own safely and not waste time, you can do that as well, okay? So you guys need to make sure that you make that decision as well, okay? So moving along, then you have the person move to a comfortable position, so lying or kneeling against a stable object, okay? A lot of people might choose to lie down. Otherwise, if there's a wall, a chair, something to lean against, they can also sit up. Obviously, this is without suspecting some form of spinal injury. If there was a spinal injury, we would be leaving the person on the ground, and we will obviously go over how to check for all of that as well. So any questions on performing a primary check for anybody?
Nope.
Okay. All right. So now we're going to perform the physical exam. Okay. So check the person from head to toe. You guys need to remember that when we start a physical exam, it's going to go from head to toe. Okay. You never want to start the other way. Okay. You are going to be looking for dots. Okay. So remember that acronym. You are going to need to know what that acronym means because you're going to need to repeat it back to me. Okay. You're not going to be able to say, I'm looking for dots, and then not being able to tell me what it means, okay? So we're looking for deformities in our limbs, things of that nature, open wounds, obviously, okay? Tenderness, okay? What can tenderness mean? Do you guys remember what possibly if we found, say, tenderness in the abdomen, what that could mean?
Can it be like a broken rib or something?
Rib, yes.
Broken rib. It could also be internal bleeding, okay? And remember, if we think that we have internal bleeding, that is also an immediate call to 911. But yes, ribs, broken bones inside your body, ribs, things of that nature that you can't see that are not protruding through the body, okay? And then obviously swelling. Swelling is a clear thing to show you that something is obviously wrong in the body, okay? So you're also going to look for medical identification tags, okay, whether it be a necklace or a bracelet. Do you guys remember what those medical identification tags could tell us? Anybody?
What medicine they
medical
can take.
history?
Yeah.
Yep. Or
What
if they're
the-
diabetic, things of that nature, okay? So if someone has a severe medical issue, they're probably going to be wearing a medical tag. So this is always something that you should be looking for, okay? I will get more into the dots part of it when we go into performing the actual physical exam, okay? So we've now done our primary check, we've performed our physical exam, okay? And now we're going to obtain sample, okay? So remember, you guys are gonna need to know what sample means as well. You can't just say, hey, Coach K, sample. You got to tell me what every single one means. Okay, so we have signs and symptoms. Okay, obviously these are signs and symptoms of things that are wrong, things of that nature. Allergies, okay, you're going to ask them if they have any form of allergies to medications, bee stings, food, anything along those lines. Okay, that's going to be important. Medications, what type of medications are they taking, whether it be prescription medications or even over-the-counter medications such as Tylenol, Advil, things of that nature. All things that you guys are going to need to know and you're going to need to ask them. Okay. Pertinent past medical history. Okay. So let's just take an example. pretend somebody's having chest pain, something along those lines. If they say they've had a history of angina or they've had another heart attack, things of that nature, this is why we need to ask about pertinent past medical history. Even if it comes to just an injury of a joint, okay? Do we know that can they tell us that they have torn their ACL, things of that nature, okay? And then obviously last oral intake. So when's the last time that they drank water, ate food, things along those lines. And then the events leading up to the illness or injury. What can they tell you happened before they either got ill or they got injured? Okay. Can you guys think of a reason why you're going to obtain a sample from an individual every time? There's two that I can think of.
To get paramedics.
Yeah, exactly. You want to be able to give the paramedics all the information that you have gathered, okay? And also for yourself, okay? That way, you know, say someone's talking about leading up to the injury, what happened, things along those lines. Did they fall on their head? Did they fall down and hit their head? That would denote, okay, well, maybe this person might have a concussion, okay? And yes, you guys are not EMS, but you are able to then let EMS know, and then you know how to kind of treat the person until EMS arrives. Okay, so any question on finding what is wrong with an alert and responsive person? Okay, for this one, you guys are not going to actually have to perform the primary check or the physical exam. I just want to know the steps that you would take to actually find out what is wrong with a responsive person. Okay, so make sure you guys go over that as well. Okay, so we have two more to go over. Okay. So placing an unresponsive person in a recovery position. Okay, if you guys go to chapter 4 in your lecture slides, there is a video on there that shows you how to place someone in the recovery position. I will play this for you guys on Wednesday one more time before we go over this. Okay, but let's just kind of talk. Actually, let me find the slides for you guys. It'll be easier for me to let you guys know. Okay, hang on. Okay. All right. So, okay. Most people, like we talked about, should not be moved. Okay. You're only going to want to move the person if there's going to be more physical harm if you actually left them there. Okay. And most of the times you are going to want to place a person in a recovery position unless they can easily sit up or lie down. Okay. So let's go through this together, and then obviously make sure you guys watch the video. And like I said, I will play it for you one more time. Okay, so if you see this individual right here, she comes up to her, she is lying on the ground, okay? She's going to kneel next to the person's side. It doesn't matter which side you guys choose, okay? Just whatever side you choose, then there's going to be a certain way that you have to place their arms and roll them over, okay? If their knees are bent for some reason, you're going to straighten both legs, okay? You're going to place the arm that's nearest to you or nearest you out from the body. So if you see this right here, okay, this arm is nearest to her, she's going to place it out from her body, okay? The next arm, she's going to bring across the chest onto the person's shoulder, okay? She's going to bring it over like this. Her other arm is going to be up. The arm that is on the ground, her palm is going to be facing upward, okay? So make sure it's not turned this way, anything along those lines. The other arm is brought across the chest, okay? And the hand is going to be on the shoulder. Okay, then you are going to grab and raise the knee that is far from you. Okay, so she's grabbing that knee that is far away and bending it up. So now you can see that the two limbs that are furthest away from you, this one, or her arm is bent up with her elbow and her knee is bent on this side. Any confusion thus far? No? Okay. So the reason we bend these two, okay, because this is how we're going to roll the individual, okay? You're going to grab the person's bent knee and shoulder and roll the person towards you onto the side, okay? So as you can see, she is grabbing her shoulder, okay? And then also right under her knee on her hamstring, okay? The reason we have this arm that's across on her shoulder like this is as we roll the person over, this hand is going to give a little bit of support onto her shoulder. So when we roll that individual over, we're not hurting their shoulder. Okay. It's not as easy as it looks. okay, if you're actually doing this on a real person, it takes a little bit of strength to roll the person. If you think about this, if the person is injured or if they're unresponsive, but they're breathing, okay, and you're rolling them over, it's almost like you have dead weight. So you really need to take that individual and roll them over, okay? Obviously then, okay, you're gonna adjust the top leg so both the knee and the hip are bent at right angles, okay? So think 90 degrees, okay? So you want right angles. This hip is gonna be at a right angle. The knee is going to be at a right angle. So this picture you can kind of see a little bit better. It is not a perfect right angle, okay? Don't think you guys have to get to the nitty gritty of exactly 90 degrees, okay? And then you're gonna keep the top hand under the person's cheek. So as you can see here, after you've rolled them over, you're going to make sure you move that hand under their cheek, okay? So they are resting on the ground. Can you guys tell me what are some reasons we would be putting a person in a recovery position?
Wouldn't it be if like they got into like a car accident?
Say it again, Lizette, I didn't hear you.
Like, let's say if they get into like a car accident and like they removed themselves already.
Well, right, okay, so we're gonna be wanting to place most people that we find in a recovery position, but there's one thing that I'm looking for.
Is if they fail,
Say it again.
when they fall.
Yeah, okay, so maybe I'm not doing the best to describe exactly what I'm looking for. Okay, so we've rolled a person on their side into a recovery position, okay? So they are comfortable, but also we have to think of things along the lines of they get sick. If they throw up or anything along those lines, we don't want to keep them on their back, okay? Because they can obviously choke on bodily fluid. So that's why we want to place them on the side in recovery position. So obviously this recovery position is for someone who is unresponsive but breathing, okay? Obviously if they're unresponsive and not breathing, we would be performing CPR using an AED or waiting for EMS to arrive, okay? Does this make sense to everybody a little bit? Okay, hold on, let me go back to the other slide. Okay, so this basically just goes through everything that I showed you on that slide, okay? So for Wednesday, okay, I have not decided if I really want you guys to do this on each other. I also don't know if I have any mats to place you on, and I don't really want you laying on the floor. So I want you guys to know the steps, okay? So you're gonna have to make sure that you can give me step one all the way down to the end of having the person in their recovery position, okay? So you have to just be able to verbalize this to me. If you guys can verbalize this to me, there's absolutely no reason you shouldn't be able to actually perform it, okay? Any questions on this whatsoever? We have one more to go over. We're good?
Mhm.
Okay, moving along. Let me find the last one. Okay, so performing a physical exam, okay? I'm also not gonna have you guys do this on each other, okay, just for COVID reasons, okay? But I'm going to give you a scenario, okay? I'm going to tell you maybe what injury this person has, and I'm gonna ask you how you find it. But then I also want you to explain to me how you go through the entire process of a physical exam. A physical exam is going to be very important if you guys are ever faced with a situation that you have to figure out what is wrong with someone, okay? So obviously we take and verbalize standard precautions, okay? That should be a given for all of you now, okay? And then, so we are gonna start where? We're going where to where?
Head to toe.
Head to toe, okay? So always remember head to toe. Okay, so we're gonna start at the head and we're gonna check for dots. Do you guys remember what dots stands for? Someone?
Deformities.
Yep,
Open wounds.
yep.
Tenderness.
Tenderness and wasn't sweat. I don't remember.
Swelling, you're close.
I was swelling.
Swelling,
I was gonna
okay?
say that.
So deformity, open wounds, tenderness, swelling. Okay, so we're gonna start at the head. Okay, you're gonna compare the pupils. Okay, they should be the same size and react to light. Okay, so if you have someone open their eyes and one of their pupils is larger than the other, what are some things that could possibly be wrong with that person? Can you
They're having
guys
a
think of
stroke.
any? Say it again.
Concussion.
Was it a stroke?
A stroke is one of them. Anything else?
Concussion.
I didn't
Mhm.
hear what that was.
Concussion.
Concussion is another, yes.
Mm,
Can it be brain hemorrhaging?
If it is, it could be, okay. The ones that you guys will, that a pupil swelling larger than the other is probably a concussion, okay, or a stroke. Yes, it could be brain hemorrhaging. The point is, if you guys see a pupil that is larger than the other, that warrants a call to 911 immediately, okay? That is something that is obviously wrong. It could also be things like shock, okay? So make sure when you open their eyes, you can, if they're responsive, you can have them close them and then open them to see how the pupils actually respond to light. So when you are opening your pupils, okay, initially your pupils should restrict, okay? Because they're sensitive to light. If that doesn't happen at all either, you know that there is a severe issue and 911 needs to be called, okay? Then you're gonna proceed to look at your ears and your nose to see if there's any clear or blood tinged fluid, okay? And then also check the mouth for objects that could block the airway, such as broken teeth. If you find broken teeth or something in the mouth, you need to make sure that you take it out of the mouth, okay?
Mhm.
Then we're obviously gonna move down to the neck, okay? Same thing, looking for dots, okay? You're also going to look for a medical identification necklace, okay? And then when you get down to the appendages, arms and legs, you can look for a bracelet or an anklet, things along those lines, okay? So then we're obviously going to go to the chest, check for dots, and gently press inward, okay? So you guys have to remember there's also 4 quadrants in the chest, okay? You're going to be pressing down on all 4 of those quadrants. Can you tell me why you would be pressing down, okay? Not forcefully, but gently. What are some of the things that you're looking for?
The post,
Say it again.
like their post or something.
Well, their pulse you'll be checking in their up here in their brachial
Neck.
artery, or carotid artery. I'm sorry. But if you're pressing on the abdomen, remember if we're looking for dots, okay, we're looking to see if there's any tenderness. Okay, if the person's responsive, they'll be able to tell you that hurts. Okay, you'll also be able to feel if there's possibly a broken rib, something along those lines. If it's an area that's tight, anything along those lines. Okay, so this is why you're going on the physical exam, you're going to be pressing in slightly. Okay. Then we're going to get to the abdomen. Also check for dots, gently press downward in all 4 quadrants. Okay, the same thing along, I described this to you guys wrong. I'm sorry. So I was on the abdomen. Okay, so if we have gone down to the abdomen, we were past the ribs, things of that line, we're now pressing in. Let's take a step back since I goofed it up for you. Okay, when we're on the chest, we're gently placing our hands on the outside of the ribs and pressing inward. Okay, there we are looking to see if there's obviously tenderness, broken ribs along those lines. The reason we want to check for broken ribs and things like that there, obviously, yes, it's a broken bone, but when we break our ribs, we have to remember that our ribs house our heart, our lungs, things of that nature. We want to make sure that those ribs have not punctured a lung. Okay, obviously when EMS arrives, if we can tell them that there was tenderness there, then they obviously understand, okay, I need to check that area, things of that nature. Okay, so sorry if I confused you guys. Remember head, neck, chest with the ribs, then we're going down to the abdomen and pressing on the 4 quadrants. Sorry, it's obviously a Monday morning for me as well. Okay, then we're gonna go down to the pelvis, so where your hip bones are, okay? Again, check for dots. You're gently going to press inward on the top of the hips, okay? After you've done that, you're going to press downward on the top of the hips, okay? We're checking to see if we have any tenderness there, broken bones along those lines, okay? As you guys are doing this, obviously we are not pressing in greatly and super hard. We're pressing gently. We're trying to see if we get a reaction out of the victim, okay? So we can understand what is wrong, so we know how to treat it and we know how to tell EMS, okay? Extremities now, so after we go to the pelvis, we go to the extremities, we check the arms, okay, all the way down to the wrist, and then we check the legs all the way down to the ankles, okay? You can be looking for medical tags on the wrists and the ankles. Mostly it is going to be around the neck or around your wrist, okay? What I want you guys to remember for extremities, you are also checking for circulation. Where can we check for circulation? Can you guys remember if we're talking about hands and feet?
The fingertips and toes, right?
Fingertips and toenails, okay? So obviously we have that capillary refill test, okay? So obviously if your fingernails are blue, we can assume that there's poor circulation, there's not enough oxygen getting through. But if we or press on the finger and then release, you should be able, if you guys all did this, you should be able to see your nail turns white and then all the blood rushes back quickly. If it is not doing that, okay, we know we have an issue with circulation. Obviously, maybe the individual isn't breathing as well, okay? And then the last thing we do, once we have checked the person, if no spinal injury is suspected, okay? Remember, if we suspect a spinal injury, the entire protocol is going to be different, but we will get to that at a different time, okay? So if you suspect no spinal injury, you're going to want to turn the person on the side, okay, kind of like you would in the recovery position, so you can check the person's back, okay? You always want to check the person's back. You don't want to forget that because they could have injuries there as well, okay? And also checking for dots on there, okay? Any questions whatsoever on the physical exam? Okay. So when you guys are doing this and when you guys are explaining this to me, if you guys get stuck in an area or something, I'll give you a clue. Okay. But it's most important that you guys can actually verbalize to me that you understand the steps that need to be taken. So obviously physical exam, we're starting from head, going down to toes. We understand what dot means. For the primary check, we understand what dots and sample means. All those types of things, okay? These are very crucial steps in order to understand what is wrong with our victim and also how we should proceed to treat them, and also the information that we could then be able to give to EMS, okay? Are there any questions whatsoever on this stuff? Or is it kind of self-explanatory to you guys right now? Ooh. Okay, all right. If you guys don't have any questions, okay, I'm gonna let you go, but don't sign off yet. I want you to make sure that you guys go into your Blackboard and look over these skill sheets, okay? Look over the 4 skill sheets that I talked about. These are the rubrics that I'm going to be used to grading you, okay? Make sure you kind of review chapter 2 and chapter 4, just so if I ask you a question or give you a scenario, you can how to proceed or how to answer that. I'm not going to give you scenarios out of left field, something that we haven't talked about, but I want to see that you guys are thinking about what might happen or things along those lines, like what are things that we can look for in a person as to know that maybe they're not breathing correctly, or the things that I kind of said to you guys about the pupil. So just make sure you know general scenarios and things that you need to look for. Okay. So any questions whatsoever?
No.
Okay. Obviously, once we get into this on Wednesday, if you guys have questions before we get into the skills assessments, ask, because once we get into the skills assessments, we're all going to need to obviously be quiet. You guys can work at your computers while another individual is going. We should not have to be there all class period, but I want to make sure that we get as many done as possible, so then we can concentrate more on like CPR, first aid, things of that nature. Okay, remember, if anybody's uncomfortable doing anything along those lines, make sure you guys let me know. And we will obviously work around all that with you guys. Okay, so if you have no more questions, I'll hang out for a few minutes. Otherwise, I'll see you on Monday. Please be on time. I know 8:30 is early, but please be on time at 8:30 so we are not there until 10 o'clock. Okay, all right, have a good day, guys. It was good to see you all virtually finally.
Will it be a live streaming of the class?
At while we were in lecture or lab on Wednesday.
Mm-hmm.
If I can get the actual camera working, I can do the live stream. Are you not going to be there?
Because I have to stay here until my mom gets back from work with my siblings.
Okay, so just do me a favor, email me, okay? Because we have a few days that